management in some patients is prokinetic therapy. Prokinetic therapy is medications that encourage the esophageal muscle activity to clear the esophagus. They oftentimes will enhance the emptying of the stomach and will also, in some cases, actually tighten the valve between the food pipe and the stomach. There are a variety of medications that are available on a worldwide basis for this. There's very few medications available in this country. The one that was promoted very heavily that was just pretty much taken off the market is Propulsid, because it caused some undesirable cardiac side effects. And it was just removed from the market. It can be acquired in special circumstances. My experience is it's very hard to acquire the medication. It's probably the best one out there for doing what we want it to do, but it's no longer available. Reglan has been available for a long time. My feeling is not to use Reglan on a long-term basis. I've used it in some patients to help with management of nighttime reflux disease, because I feel in that supine position or lying position it may be more helpful to work, physiologically and help the valve. It can have side effects, and the side effects may even be worse in patients you want to use it in, which are the younger patients. And it can have a lot of side effects. And I'm not really keen on it for long-term use. I don't think it's something that should be used very long-term in patients. There is another medication available in Canada, domperidone, which is fairly effective. I don't have a lot of experience with it. It's not available in this country. Have they applied for approval in this country?
I know a little bit about domperidone, and this is a drug that's similar to Reglan. It has great effects at helping to stop reflux symptoms. It's also a very wonderful anti-nausea drug. But to cut to the chase and make it short, there are political forces in the governments and the pharmaceutical industry that will probably never let domperidone be here in America. It's been tried many times, Vito, and as far as I know, there's no way to get it yet.
In children, erythromycin antibiotic is used very commonly to help with motility, and it's a prokinetic drug. I don't recommend that for use in adults, and I don't think it really plays a role in reflux management.
Okay. Before we wrap up, I want to thank my colleagues for making this easy for me, Dr. Proscia and Dr. Wolkin. I think you've both given very thorough and thoughtful presentations and explanations to the questions. There are many questions here that people have written. They're of a more personal nature, descriptions of their own problems, and I know that Dr. Wolkin has to leave, and I don't know about Dr. Proscia, but I guess I'm going to volunteer for 10-15 minutes. I'll be up here for those people who did not get their questions answered. I'll do my best to answer them for you if you really want to listen. And that's it. I want to thank also Linda Schwartz for putting this all together for us, and for you all being a great audience and having very insightful questions, and hopefully you'll come back for our next talk. Thank you.